Hey guys, and welcome back to Rarely Typical, a podcast where I am talking about what life actually looks like when you're living with a rare disease. I'm Jerry Langan, and today I want to talk about something that I know you guys are going to relate to, which is the fact that managing a chronic illness has quietly become a full-time job for me. I never applied for this job and I never trained for it, and I'm honestly just figuring it out as I go. But when you get diagnosed with something like pulmonary arterial hypertension or really any chronic illness, people will tell you a lot of things about it, and they will tell you about the medications and the appointments and the lifestyle adjustments. They will talk about what life is going to look like when you leave the hospital. And honestly, they'll give you all of these pamphlets. They will give you referrals. And if you're lucky, you might get assigned a social worker or somebody that will check in on you once you get home. You might get a patient representative. There's all kinds of options for what they will give you when you leave a hospital. But what nobody, and I honestly mean nobody, tells you and says to you when you leave is that, do you understand that this is about to be an entire job? Like, this is about to be your second life. And I feel like I had no background on any of this, and I'm not a nurse. I'm not a medical biller. I don't have a degree in insurance navigation. I didn't major in pharmacy. I was not a pre-med major. Honestly, whatever you even call the skill set that is required to manage this level of care, I was just not that person. I was just a person, just out living her life. And then 2018 happened, and suddenly I'm a full-time case manager. I am a patient advocate. I'm a pharmacy liaison, and I'm a medical coordinator all in one. And it's all for one person, just me. I don't even know how people that actually do these jobs are able to manage more than just one person because I can barely manage myself. Most days, I'm still just guessing at what I'm doing. Okay, so let me tell you about this year specifically. This has been the craziest year when it comes to medical stuff. And honestly, I should have expected it. I really thought that this was going to be one of those like chill years because I haven't had a lot of chill years. But, that always happens. And this year has particularly been a lot more already, and it's only April than I expected. Back in February, after a routine PAP, I had a second PAP done, and I was told that I had another abnormal PAP. And honestly, this is not pulmonary arterial hypertension related, but it is chronic illness related. So I'm going to tell you about it. I have had multiple abnormal PAPs over the last, I don't know, 3 or 4 years since we have been here. And I've had a couple of colposcopies. They call it a colpo, and that basically just means that they took a biopsy of my cervix and were looking at spots that were showing up. And my cells have been coming back high grade, but then most recently in February, my cells came back super high grade. And so my gynecologist recommended that I should do a LEEP procedure, which is pretty much the next step after you've had all of these happen. And honestly, for most patients, most women, that is a pretty normal thing. It's outpatient, it's not a big deal. My gynecologist likes to do it under sedation because I've heard from patients who have had it localized that it is very painful. And so he told me he's not in the business of making patients hurt, and I'm with him on it. So that's awesome. But the anesthesia part adds a complexity to the already complex issue of this person, me, my medical history. And it has become this whole thing. And I honestly didn't expect it because normal patients, it's outpatient, and then you go in, they handle it, and then you go home. It's not fun, but it is doable. And it's definitely doable locally in your area. Except here's the thing about having a complicated medical history when you're me. An outpatient surgical center near me that they referred me to had me on the schedule in March, and I had to wait a whole month. And then the week before, they called me and they were like, let's go over your medical history. We go over my medical history. They're like, oh, okay, we're going to have the anesthesiologist look at this. And so then they call me back like 2 days later and they're like, yeah, so you're not going to have it done here because you're medically complex and we're not comfortable doing it. So they were like, you're going to have to do it at the local hospital. Okay, cool. They wouldn't take me. I'm too high risk. I get it. So I get referred to the local hospital. The local hospital here, I think, is a trauma 2 center. And It was honestly the same answer. I thought it was going to be fine. My doctor wrote a medical clearance for me to have this general anesthesia done. He said it wasn't going to be that big of a deal. It honestly is like 10 to 15 minutes long, I think. Like, it's really not that big of an issue. And he wrote a medical clearance. He sent it to the hospital, and I get the same answer. They call me to talk about my history, and then they call me back and they're like, yeah, so we're not going to be able to do it here. You're going to have to go somewhere else. My history is too complex and too much of a liability, and so they were not comfortable doing it. So then for what should have been a routine procedure now has to be done at Mayo Clinic, which is fine because that is where I'm seen normally. That is who takes care of me. I am very confident with their ability to handle my case, but they also are 2.5 hours away, and I was just not prepared for this complication. I guess I just expected, because it was a routine procedure, that it was going to be fine. But now that I am in it, like I'm in the weeds of it, I am very concerned that somebody locally can't even take care of me and they won't touch me with the 10-foot pole. And I want to be clear, I do love Mayo. I genuinely love them. They have been fantastic. They always take care of me. They've taken care of me in ways that I cannot overstate. But there is something so deeply exhausting about not being able to get basic care close to home. Like, why do I have to travel 2.5 hours? I probably could have had it done in Orlando, but it's just one of those things where having it done in Orlando would have meant establishing in a new hospital, and it probably would have taken longer. At this point, I'm 2 months post being told I had to have this procedure done, and I'm still not able to have it done. So my body has decided to be an overachiever in all of the wrong places. And what makes it even more fun, and I will say that with full sarcasm, is that I literally was just at Mayo, I think last week, for clinical trial stuff. And it's not that it's a big deal, but like 2.5 hours is just far enough for it to be really annoying. And with the kids in school and my husband on a really weird schedule, like having to plan an entire day to be there is a lot of work. And then they want me to come for a consult, even though I've already had a consult for this procedure. I get it. Mayo does all of its own things. It wants to make sure that everything is done well and accurately. They want me to do a consult, but it's going to be like a 15-minute meeting, and then I'm going to have to leave. It's just really annoying to have to drive 2.5 hours up there and then 2.5 hours back for a 15-minute meeting. And it's just one of those things where it's like, I just don't have the time. And now I can't even have it done locally because I've already had all of this stuff done. And now I have to go somewhere else to have it all redone. And they won't schedule this procedure until I go up for the consult. I'm trying to get it done virtually, but I think they want to have it done in person just in case they have to do an exam, and they probably will do an exam because technically I am not seen by gynecology, not even technically. Actually, I'm not seen by gynecology there. And so because of that, it's basically establishing a new patient, and it is like its own just eventful day. I honestly thought I had a second to breathe from driving up to Mayo because I'm on a every 12-week routine with my clinical trial stuff. And so I'm not actually slated to be back in Jacksonville until like July. And now I'm having to go back in like 2 weeks. It's fine. I just thought I was able to exist for a minute before the next thing happened. And then the next thing happened anyway, ahead of schedule, because that's just what happens these days when you're a patient. In between all of that, there's everything else that happens when it comes to being a patient. Like, that's just one example of what my life looks like now that I am a professional patient. I have pharmacy calls almost nonstop. I have to do refill requests, and there are prior authorizations that have expired that I've had to start over. This year specifically, have already had a prior authorization issue because of my Dupixent. If you are new here or you haven't been following me for a while, I have very sensitive skin and have been on the Dupixent shot for my sites. It actually keeps my skin at bay so that I'm able to keep my sites longer and that I'm not just scratching my arm until it bleeds. But that got taken off my formulary at the end of last year, and we had to have appeals and peer-to-peer reviews just to get my Dupixent approved by insurance. And that was just this year. I have to order specialty medication that comes at a specific time. I have to order it. I have to talk to the pharmacist. It has its own delivery window. I have infusion supplies, site care, site pain, site changes, all of the stuff that comes with that, Hell Week, and then all of the behind the scenes stuff that just keeps me stable, that keeps me alive. Taking medication every day, having to change my medication, having to change the medication out in my pump, just having to exist, and other doctor's appointments that are supposed to be like normal ones, like regular doctor's appointments. And it is just never ending. Most people have no idea that any of this is even happening. It's just stuff that I have to deal with every day because it's something that I've gotten used to over the last 8 years. It honestly doesn't stop. There's no week where I get to just ignore any of it. It's always something. It's always moving because it doesn't matter where you are or what you're doing. I like to think about who I was before 2018, and I honestly didn't know how to do any of these things. I genuinely didn't know how to read an explanation of benefits. I didn't know what to do when I got a bill in the mail. I didn't know how to get somewhere when you call an insurance company. I didn't know how to coordinate between multiple specialists who, let's be honest, don't talk to each other. And I just didn't know how to advocate for myself in a room of doctors who often know more than I do. I just didn't know. I didn't understand what it meant to be the expert on your body. Like, I know that I'm the expert of my body because nobody else is living in my body. But when you're in a room of doctors or you're in a room full of nurses and they're telling you something about your body, it's a completely unnatural thing to argue with them because they are usually the experts. But when you're in the room talking about what you're experiencing, you are actually the expert because they have never experienced those things. And so they only know what you tell them. But nobody taught me that. I just had to figure it out as I went because life kind of just depended on it. So I think what I want people to know or hear today, that whether you're living with this yourself or you are just someone who loves somebody with a chronic illness or you are a caregiver to somebody with a chronic illness, it is this invisible labor of managing a serious diagnosis, and it is so real and it's relentless and it doesn't have an off switch. And there are times that someone says, like, "How are you doing?" I just want to say fine, and not because it's an honest answer, but because it would take 45 minutes to give you an honest answer and probably a whiteboard to add to it. I just don't have the energy for some of that sometimes, and I don't have the energy for that conversation often. And so I will just say it's fine, but I know I'm not always fine. And honestly, most people who talk to me and know me should know that when I say I'm fine, it's probably not fine. I think that it's okay to say that out loud. I think that it should be okay to say out loud, like, it's not going very well, and then not have to explain myself. It's like no is a whole sentence, but like I'm not good is also a whole sentence. And I feel like I shouldn't have to explain myself, but I do explain myself and I do feel like I have to. And so sometimes I'll just say it's fine to avoid the conversation. It honestly is okay if you are a caregiver or if you love somebody with a chronic illness, when someone says, "How's it going?" and you say, "I mean, it's not going well, but it is what it is." And it honestly just is what it is. That's my default answer, is that it is what it is. And I roll with the punches more often than not. That is honestly just my personality. But I would be lying if I said I wasn't tired in a way that sleep doesn't fix. I am tired of being the one that has to fight for just basic things like having a procedure done locally in my area. I'm tired of making calls. I'm tired of being on hold and hitting walls and having to find a workaround for the workaround. Because I'm tired of showing up to appointments in cities that aren't mine because my own city can't handle a case like mine. I'm tired of being in a medical dead zone, is what they call this area. But honestly, I'm still here and I'm still doing it. And not because I'm particularly good at it or because I'm special or smarter than anybody else. It's honestly just because I'm still guessing. Like, I'm making educated guesses at this point, but because I don't have another option. And mostly neither does anybody else with a chronic illness. So if you're in this too and you want to know that you're not alone, I hope that that helps. I hope that you understand that I feel you and you're not alone in how much effort it takes to just continue to be alive as somebody with a chronic illness. It is a lot, and it's okay to say that it's a lot. You didn't apply for this job either, and you're doing it anyway, and that has to count for something. All right, that's what I've got for you today. If it resonated with you, I hope that someone who needs it gets it. And if you're new here, welcome. I'm glad that you found this podcast. I'm glad that you are listening to me. I'm glad that you are part of this community and that you are invested in this story. My life is not easy, and I know that the social media highlight reel makes it look like life is easy for me, but it's genuinely not. I deal with all of the same issues that everybody with a chronic illness deals with. I just deal with it on a public platform, and so you get to see a highlight reel, but there are a lot of really hard days, and I hope that I'm also demonstrating those hard days online and that it doesn't just look easy for me. I love you guys. Thank you so much for listening, and I will talk to you guys later.